Awesome. Welcome to the first session of the day. My name's Jackie Moynihan. I am from the commission, and I'll be in the room kind of supporting, also encouraging people to fill in seats as more people make their way in. So welcome to our session on Apple Health and Home. Just a couple housekeeping things. If you do have questions, you can use the app. I will be monitoring it, but I know Melody has already kind of surfaced some questions from people. So we've got about an hour here. So just gonna welcome you all into the space to participate, and I'm gonna pass the mic over to, here we go, to Melody.
Awesome. Welcome. My name is Melody Pazelt. I am the Managing Director of the Office of Apple Health and Homes. Good luck to the cameraman because I do wander. We want to make sure that we're covering all of the questions that you have up front in our presentation, and we will have some time for questions at the end as well. But how many people know that in Washington State, Medicaid is called Apple Health? So a fair amount of folks. So what this program is here to share information about is really how we're bringing Medicaid and housing together. So Apple Health and Homes. And so we have an amazing panel here today. So I'm going to pass it over to my colleagues.
Hi everyone, Whitney Joy Howard. I'm with the Aging and Long-Term Support Administration, ALTSA, Home and Community Services, within the Office of Housing and Employment. I'm our Housing Integration Unit Manager.
Hi everyone, my name is Kimberly Castle, and I am the Foundational Community Supports Quality and Alignment Analyst at the Healthcare Authority. Nice to see everyone.
We're a real casual group.
We don't like podiums. We're not very fond of mics either, but we'll make it work. So, we asked a couple of questions in the polls, so I'm not sure if folks had a chance to do the polls, but would love to have you go in and just, how many people are familiar with foundational community supports? So a few folks, a lot of folks maybe have never heard of it, so we're very excited to share what is foundational community support. So Kimberly is going to be covering that and some of the resources that go along with that. How about how many people know how to access in-home caregivers? All right, you got your work cut out. I did ask some folks what they hope to get out of the session in the prep, and so a couple of those things are a little bit more information about what is permanent supportive housing, how do we make sure it's affordable, what are the rent assistance programs, where will Apple Health and Homes be in 5 to 10 years, does Apple Health and Homes cover family homelessness, any other burning questions that you want us to cover ahead of time, or in our presentations. So you're going to be satisfied with our presentation if we cover all those things. Awesome. How available is the funding? Just closed on the capital application, but there'll be more. Yes. Did you have one?
Oh, I was going to expand on that with permanent supportive housing. What supports come back with that for maintenance and operations?
Operations and maintenance and services for PSH. So yeah, absolutely. We can address that as well. So good. Yes.
This is probably a really ignorant question, and there isn't time, but I have never quite gotten in my head how one's organization gets through the registration requirements to be eligible to be considered an FCS approved entity.
Okay.
I'm sure everybody in the room already knows the answer to that.
Not considering a lot of people didn't know about foundational community support, so we'll cover what is FCS and how do you become an FCS service provider. So Kimberly, you got your work cut out for that one. All right. So just to level set, one of the things that we want to make sure that we're talking about, and I loved the presentation this morning about how important housing is, and her story was amazing. But now think about somebody that has complex behavioral health, mental health, substance use, homelessness, physical health disabilities and how impactful housing is to their recovery. And so, you know, you guys all being in the housing world have figured this out for years, that housing is really impactful to people's recovery. The healthcare system, it's taken us a little longer. And I say that as myself because I've been in the healthcare behavioral health system for about 35 years. It's taken us in the healthcare system a little bit longer to figure out that housing, transportation, nutrition, income is vital for people's recovery. And so the healthcare system has started, and I'm using the healthcare system in a really broad term, whether it's behavioral health, long-term care, mental health, substance use, chronic health conditions. And so the World Health Organization came out with talking about social determinants of health and health-related social needs, that to really truly recover from chronic health, mental health, substance use, physical health issues, that you really need to make sure that you have these other social needs covered in your life. And so the healthcare system is starting to pay attention to housing and transportation and nutrition and employment. And so, and the healthcare system is really focused on getting people out of higher cost services. But if there's no housing to discharge people to, and so here's some data that actually represents, so 34% of people that were in an inpatient mental health facility that were homeless or unstably housed in the year post-discharge, very few of them are actually accessing housing resources. So they're going onto the streets. So how do we make sure that we're tying the relationship between mental health and substance use and the homeless housing system? Even more staggering is that 53% of people exiting a substance use inpatient treatment program had difficulty accessing housing. So the big circle on the left is their housing status following their discharge, and the bars on the right is whether or not they actually entered into the homeless housing system. And very few of those folks, less than 16%, are accessing permanent supportive housing. So we need to develop stronger ties and relationships between the healthcare, behavioral health system, long-term care system, and the housing world. And that's what we're here today to share.
All right, let's talk about foundational community supports. Click for me. So in 2018, we were able to be part of the 1115 waiver. Initiative 3 was foundational community supports. This was very exciting for the supportive housing world and supported employment world because this was the first time that we were able to pay for those services through Medicaid. So now people can get paid to provide supportive housing services and supported employment services to individuals. And so this is very exciting stuff. We had a 5-year waiver, and in 2023, we got our second waiver approved, so the MTP 2.0. And this is so that we can address those health-related social needs, really to help people have wraparound and intensive case management, specifically around getting housed and staying housed and getting employed and staying employed. So we have been going since January of 2018. We have over 14,000, maybe just a little under 14,000 people currently enrolled in our program and have served over 40,000 people across the duration of our program. We have 300 plus agencies providing FCS with it's now 570 sites across the state that do foundational community supports, either housing, employment, or both. Next slide. So let's talk about eligibility. For those of you who aren't familiar, this is, again, a Medicaid program, so someone does have to be enrolled in Apple Health. They have to be 16 years or older for both benefits. One of the exciting things about the second waiver was that we went from 18 years old in housing down to 16, so now we can serve those 16 and 17-year-olds as well in supportive housing. So really excited to be able to do that. You do have to have either a mental health diagnosis, a substance use disorder, or a disability that requires support with activities of daily living or living independently. So with FCS, you have to have one health need and then one risk factor. And so I'm going to go over that next. For supportive housing, the first one is chronic homelessness. So somebody that has chronic homelessness, that is part of the HUD definition of 12 months consecutive of homelessness or 4 episodes in a 3-year period. The great thing about this is, though, if somebody doesn't have record of their homelessness, we have a self-attestation that allows them to attest to their duration of homelessness, which is really cool for a housing program. And we also include couch surfing as part of that and doubling up. So those are 2 pieces of the program that's kind of unique to some of the housing programs that exist. Next one is frequent or lengthy stays in an institutional setting, so hospital, psychiatric, incarceration. So again, multiple episodes in a 12-month period allows them to be eligible for this program. Frequent stays in-home caregiving or residential care setting, so allowing those people that have frequent rotation into those settings is also eligible. Frequent turnover in home caregiving, so that is somebody that is not keeping their caregiving, they rotate through individuals. That happens quite often in supportive housing with folks, and so really need that additional support, right, to stay housed and do well in their housing. And then the PRISM score. Is anyone familiar with what the PRISM score is? Okay, PRISM score is a way that kind of detects how much Medicaid someone is utilizing. So different specific diagnoses and stuff, people's PRISM score tends to increase. And so someone that has a PRISM score of 1.5 or above are eligible for the supportive housing. And not everyone has access to that PRISM score. That is usually a primary care or a behavioral health agency that gets access to that, and also providers as well. So for supported employment, the risk factors are someone that is accessing housing and essential needs, the HEN program, or age blind and disabled program. So they would be eligible for supportive housing. Difficulty obtaining employment for the number of reasons up here. The TBI, physical age impairment, things like that. SUD with a history of, with a history of multiple treatments. That doesn't mean that they have to be accessing treatment, it just means they have a need for it, okay? And then anyone with an SMI or co-occurring mental health or substance use disorder. So employment's a little bit easier to get into than the housing. There's less like having to document some of those things, but still very exciting. And most providers like to do both because they really do go hand in hand together. Right? Next slide. So we do follow evidence-based practices for our program. This is really important because we really want to make sure that there's quality services being provided out in the community. For the supportive housing side, we do follow the SAMHSA model of PSH. There's 7 principles that we follow, 7 dimensions about things like choice and access to housing, housing first. It's really important that we have flexible and voluntary services to make sure folks, it's individualized services. It's really important that we're being individualized and making sure people are getting what they need specifically. And then for supported employment, it's the IPS model, individual placement and support. And so there's actually like 23 different dimensions or principles, but we really focus on 8 here. And they really go hand in hand. If you look at this list, you'll see that they're very similar in that we want to have access to, have choice, that we're making sure that we're getting people connected to what they need to be able to find that job and stay employed. Oh, yes, thank you. Yes, later today, we're having actually colleagues of ours are doing a presentation on supportive housing and supported employment and how they work together. So I encourage you to go see that. So for employment services, it's things like finding like that kind of job discovering what job looks like for somebody, right? It doesn't have to be that 8 to 5, Monday through Friday, standing on your feet, really helping someone decide what they want to do. That's really important. And being able to help work with employers to kind of create jobs sometimes and do that kind of job development for people. And this is really to help people. So to stay in that work, they have on-job support. So they don't just get them into the work, they also help them along and work and advocate with employers so that they're able to get different accommodations if needed or whatever that might look like to make sure that someone can stay and perform their job. So it's really exciting work. And then for supportive housing, there's two sides to what we do. We do that pre-tenancy support, so helping someone find that housing, talking about what they want and need in housing. This isn't just about getting someone placed in housing. This is about helping them find their home. And so whether it's, what do you want? What does that look like? And saying, okay, well, this is where we're at. What is your short-term goals and long-term goals around housing, and making sure we can do the best we can to match that for them. We really want them to be able to stay. We know when someone feels like they belong in their community, they're gonna stay longer and do better in that housing. So helping them find, working with landlords to create opportunity for housing, helping them get all those resources connected to getting into housing, rental assistance, right? That's a big one, getting them connected to what kind of rental assistance they might be able to access. And then that tenancy sustaining services is really about helping someone maintain that housing. That's so important. It's not about, here's your house, good luck, right? We want to make sure that they have the supports in that house to be able to stay there. And a lot of times that's really where the work begins. Someone's never had a house before maybe, or maybe they don't know how to maintain, keep a house, pay bills, those kinds of things. So that tenancy sustaining is really to support them and stay in there, helping them budget, getting kind of used to having a place to live and making it their home so that they want to be there. So for FCS, we do have a third-party administrator that we contract. So we hold a contract with WellPoint. WellPoint is a managed care organization, but there is a firewall between that work and what they do for us in FCS. They actually administer the program. They do all of our authorizations. They contract with the provider network. So if you were looking to become an FCS provider, we would connect you to WellPoint, and then they would kind of walk you through that process of getting credentialed, getting your provider one number, because this is a Medicaid program, and really helping you walk through how to bill for what this looks like. And support you through the work. So you have a program manager that actually supports you for your agency, and any questions you have, if billing issues come up or you are trying to get someone authorized or referrals, they really do all of that work to administer the program for us. On the HCA side, what we do is really that training. We have technical assistance and training that we provide the provider network to ensure that folks that are providing these services get what they need so that their staff can do the work well. And so we do tons of training. We have 4 trainers on our team that go out and work with the provider network to ensure that they can get connected, understand the work. We pick any topic you want to learn about and we'll teach it. We have 2 housing trainers and 2 employment trainers that support you. And then WellPoint has their own orientation. So they have a clearinghouse that you can get for free to bill for FCS. And they'll walk you through that. There's an orientation with them. And then of course, we want to work with the provider network as much as we can to ensure that you have support all along the way of you providing these services. It's really important to us that we get you what you need to do the work well. So we did have a brief enrollment pause this year. We are still a budgeted program. We're not an entitlement because we're part of the waiver. And so we had a huge amount of enrollments for the first time in our program, and did have to put a pause on enrollments for a brief time on working on some new policies and things to ensure that we could forecast accurately for the future of our program. And so just wanted to kind of touch base on that. We were able to lift the pause this last month, and WellPoint's been working through the wait list. We had about 5,000 people on the wait list total, and we're now currently working, I think, on the last 1,000 starting this week. So we're back to regular scheduled programming, really, and people can get authorized and processed as soon as that wait list is kind of processed through and people are getting connected to the services. So we're really excited about that, and excited about it was a learning experience for us to be able to kind of see what we needed to do to forecast and make sure that this doesn't have to happen again. So we do have some really exciting initiatives connected to FCS that have come through different either proviso or legislation. One of those is the TAP program. Has anyone heard of the TAP program? Transition Assistance Program. This is a really cool program to help people transition into housing. So there's funding for folks to do things like pay for past arrears of different utility bills or rent, those barriers that really kind of stop someone from being able to get into housing. Sometimes it was household goods that they needed to be able to get into the housing, first, last, and deposit, things like that. Application fees, that was a big one that we were really excited about because that's a huge barrier for people who are in very low income or no income to have to pay $40 $45 every time they apply for a unit, right? That goes really quick. And so TAP has been a huge piece of the FCS program that's really helped people transition and move into that housing, which has been a big barrier in the past. So we're really excited about that. We are, I think, spent on TAP currently until January, but we have some new stuff coming the way to increase that funding for the TAP program. So stay tuned. Glide Path is a very exciting program that also came through Proviso in 2023. A few years back, the governor's office reached out to our team and said, what can you do to help us end homelessness? And we got to spitball a ton of ideas, like 17 or something, and they picked up quite a few, and Glide Path was one of these. What we know is that the system tends to disincentivize people from going back to work, right? And so we wanted to give a grace period for folks who were accessing housing and essential needs program and wanting to go back to work, so they increase their income, they get cut off. There's a cliff there for them. And so what we did was we partnered with Department of Commerce, and we were able to work with the HEN program, which now offers folks who are enrolled in FCS supported employment and are also losing their HEN for any kind of eligibility, whether it's increased income or other eligibility requirements, to be able to access 9 months of additional rental assistance to kind of give them that grace period to kind of ease into what's next for them. And on the HCA side, I was able to contract with 9 providers in 9 different regions across the state who provide additional benefit planning services. So really, there's a huge lack of benefit planners across our state. It's really hard to access them when they do exist. And so this program allows us to work with these providers who are getting many people certified in benefit planning, which is so exciting. I think I got 7 people certified just last year in benefit planning across the state to increase that access for those folks. And some flex funds for supported employment barriers. So helping somebody get back to work. I've been able to buy laptops, pay fines so they can get their driver's license, car repair, work clothes, all those things you can think about that are barriers, some schooling. It's really exciting, the work that the Glide Path providers are doing. And if you want more information, please reach out. Yes, so they have to be enrolled in FCS supported employment and have lost their HEN within the last 6 months or are losing their HEN. So we're working with the HEN programs. Okay. That is the Bridge pilot program. That's the HEN Bridge is the Glide Path. So there's additional pot of money outside of HEN that supports this specific population, unless you're thinking of something else. Yeah, absolutely. So one of the cool things also that came through the MPT 2.0 was the health-related social needs. This is really exciting. We're still working with CMS, Center for Medicaid and Medicare Services, but this is going to be the first time that Medicaid will be paying for rental assistance. It's very exciting. Can't wait. And so also the housing transition. So some of this funding will go into the TAP program to help support that and increase the funding for TAP. And then please stay tuned. This is going to be really exciting to be able to share how we're going to be using that 6 months of rental assistance to support folks. Next slide. So again, TAP program is going to be utilizing some of these services for the navigation part of this work. And then we're going to be leveraging our provider network to help folks get connected, working with Department of Commerce and Apple Health and Homes for that 6 months of rental assistance. And so again, we're still working through protocol and figuring out how exactly that'll flow. But this is really, really exciting. Kind of one of those things we didn't think would ever come. And now we get to say Medicaid's going to be paying for rental assistance. So. All right, I just wanted to bring up a list of additional resources. You will get these slides sent out to you, so I'm not going to go over the resources, but we have a lot of great things to connect people to different things out in the community. Our Pathways to Housing and Pathways to Employment websites, I encourage people to get on there. Tons of information, not only for provider networks, but for people looking for housing and employment. So thank you so much. I'm going to pass it on.
So this is a ton of information in a very short period of time. And a lot of folks, pretty much no one, raised their hand about how to get someone connected to caregiver. So I just want to call out I have a couple of fabulous colleagues here, John Curlow, Joanna Wooden, if you guys can raise your hands. We love, raise your hands again. Yep, there, okay. We love chatting with anyone, anytime, anywhere. We do a lot of deep dives. John is our housing capacity program manager. Joanna is our field liaison program manager. So if you would be interested in having a deeper dive conversation around anything I'm about to present, or to better understand how to leverage any of ALTSA's housing resources, or how to better connect with your local home and community services office, John and Joanna are really great people to talk to, and we'd be happy to set up some time to chat. So long-term services and supports. Those are our home and community-based waiver, state plan, Medicaid benefits to help an individual with activity of daily living needs be able to either maintain their housing, so living independently out in the community in their own home, or if they're interested in living in a residential setting, an assisted living facility, an adult family home, a skilled nursing facility, if they need that level of care, those are also resources through the long-term care system. I feel like the residential side of the house are what people are more familiar with when you think of long-term services and supports, long-term care. And so I have a background in affordable housing, permanent supportive housing, and when I came into the world of long-term care services almost 8 years ago, I was not aware of all these resources. So basically, I just pushed my way in with Healthcare Authority and Commerce, and let's just go, talk together about all these things so people are aware of how you can be leveraging these Medicaid resources to support your clients living in their homes for as long as possible. And to be aware, don't wait until you think somebody needs a higher level of care. If somebody's interested and willing to explore an intake, an assessment for long-term care services, getting them connected early will help them be able to live in their housing with that dedicated support longer. So some of the in-home services, and there is a slide that has, links to our websites and all these great resources you can find there. Some of the in-home care services that we provide are bread and butter is personal care. So having a caregiver come into someone's home on a regular basis to help them with their activity of daily living needs, and then also things like bringing them shopping for food or clothes, or to a medical appointment, things like that. A caregiver can also do laundry. But then we also have funding for environmental modifications. So if someone needs, a door widened because now they're in a wheelchair, or they need a ramp built, we actually have funding through Medicaid that will pay for those things. Supportive housing, supported employment. We partner with the Healthcare Authority on the 1115 Foundational Community Supports benefit. We also have a state-funded supportive housing benefit that I'll go over in a little bit. Transition and sustainability funds. That's kind of helping people move into housing. We have funding, state and federal funding for those things. Adult day health, nurse delegation, assistive technology. So if somebody, during COVID, being able to connect people to internet, computers, iPads, some kind of access to be able to have telehealth appointments, still be able to see, get their healthcare needs met. Those are things we could pay for through assistive technology. And so how do you get someone enrolled in long-term services and supports? You need to start with home and community services. We have local offices across the state. And so you would call the Home and Community Service office, or you can go on to Washington Connection. And the way our assessment works is you have to meet functional eligibility and financial eligibility. And those are two separate workers who are assigned to determine if you meet functional eligibility and financial, but it's happening concurrently. So you apply with someone, help them apply, and then they'll get assigned to a case manager who will meet with them and conduct an assessment to ask them about activity of daily living needs, things like bathing, toileting, transferring, medication management, if they have help with these things, if they need help with these things, and that will determine if they are eligible for our services, if they want to live independently in their own home. They would get a certain number of caregiving hours a month if they want to live in a residential setting. Based on that assessment, they would qualify for a certain daily rate for that residential setting, and then the case manager would help them find a residential setting that would, take that rate. Financially, most of our programs, you don't necessarily have an income cap. If you make more than a certain amount, you have to pay a certain amount toward your cost of care, but you're also opened on Medicaid. So let's say you are a Medicare client, you weren't getting your medication covered, now you're open on Medicaid, and it actually could be more cost effective for you in the big picture of your budget to pay towards some of your cost of care because now you have Medicaid. But we do have a $2,000 asset limit. So the public benefits specialists, there are some things that they can work around. So I always encourage people, even if you're not sure if somebody would qualify, if they're willing to do the assessment, go through the assessment, because the public benefits specialist could work around some of those asset pieces. There are some exceptions. The community supports, we do have all of these things that you see here to help someone they're either transitioning out of an institutional or residential setting to their own home or transitioning out of a shelter or off the street. We do have these resources both through state and federal funds to cover all of our long-term service and support clients to be able to pay for these things. We authorize a provider to go make these payments. And some of these things, eviction prevention funds, pest eradication, during someone's time living out in the community, if their tenancy is ever at risk, if they, have bed bugs and they brought them in and they need to pay for the treatment, we can actually pay for those things to be able to help that person continue to keep their housing. We also, since 2012, have a state-funded rental assistance program. So we have largely focused this on people exiting institutional settings. So originally it was for people exiting skilled nursing facilities. So if somebody's in a skilled nursing facility, wants to live independently, cannot afford to do so, we have state funding to actually be able to pay that person's rent while they're working on finding permanent housing. So what that specifically means or looks like is basically applying when Public Housing Authority wait lists or lotteries open, they're applying for that. If they're interested in, moving, and they can apply for tax credit property wait lists, basically they're kind of on the lookout for permanent options, and we will pay the rent as long as they need until they're able to secure a federal voucher or some other permanent type of housing or rental assistance, or maybe don't need rental assistance anymore. In 2016, we expanded to bring on our governor's Opportunity of Supportive Housing, or GOSH program. So we also are able to pay rental assistance and provide supportive housing services for people exiting or being diverted from Eastern or Western State Hospital. We are also hoping to be able to expand our eligibility for a rental assistance program, knowing that there is this catastrophic trend of older adults entering into homelessness, being able to support some individuals, either prevent them from becoming homeless, or if they are experiencing homelessness, being able to also provide them with a rental subsidy. So that is something we're hoping maybe can come out of this next legislative session. We don't currently have the ability to do that, though. We based our rental assistance program off of HUD Housing Choice Voucher Program policy, because the intent is to kind of like seamlessly just switch funding sources without having to move out of your apartment. So if your apartment passes Housing Quality Services, HQS, soon to be Inspire, inspection, and you're within the FMR limit, when you get a voucher, that unit is already approved essentially for use of that voucher. So somebody could just kind of seamlessly on the back end, the rental assistance changes, they don't have to move, they don't have to leave their home. We have Spokane Housing Authority, hi Kelly. We have Spokane Housing Authority actually administering our subsidy statewide. Originally, we were, our program managers were entering into a housing assistance payment contract with every single landlord every single time a client leased up. And so we're like, you know what, this is the bread and butter of public housing authorities. They're built for this. So we put out an RFP, and Spokane Housing Authority was the successful bidder. And statewide, they administer our subsidy, and we've built up a really great working relationship with them. And we kind of have a nice, like, seamless process going where it takes less than a week of turnaround once we submit an application for that voucher to be issued. And we do try to limit the 120 FMR. Because it's state funding, we are more flexible. So we do have the ability to go above that, or to just have more flexibility in general than a housing choice voucher or any kind of HUD related funding. So I do just want to point that out. And then we also can enter into 5-year contracts with our subsidy. I have another slide here in a moment about set-asides. And then I had just mentioned GOSH, so we have our Governor's Opportunity for Supportive Housing. This is our state-funded supportive housing program I mentioned a little bit ago. So we connect with people while in the state hospital with a supportive housing provider. The supportive housing provider helps that individual search for housing and, secure housing, move into housing in the community. Or if somebody's on an involuntary treatment act hold at a local psychiatric facility, those individuals can be diverted from going to the state hospital by entering into the GOSH program as well. And then that supportive housing provider stays with them through tenancy and provides all those services that Kimberly mentioned a moment ago. These services. Coordinated personal care. So this is a newer initiative. So there is this trend of older adults living longer, needing long-term services and supports, having housing instability, and there's also a trend of less caregivers. So that's not like a good, moving in 2 different directions. That's not great. And so one of the things that we're trying to do to help ensure people who have caregiving needs are able to get access to a caregiver is looking at areas that have geographical areas with high concentrations of individuals in a building or in a location very close together. So maybe a project-based public housing authority building, a permanent supportive housing building with on-site staff there, and then essentially assigning a caregiver to the building. So the caregiver gets their 8 hours of services, 8 hours of work covered in one day without having to drive all around a city. They're at that building all day. And then individuals with a variety of caregiving needs, so either very low, like med management, which is something you really would need daily, but if you only qualify for 30 hours of caregiving a month, the caregiver is not going to come for 15 minutes a day. So under this model, though, that is something that a service that could be provided to that individual, because that caregiver is just there that entire day working with anyone who needs their caregiving at a time that is more flexible for the individual. Or if, the normal time they have a caregiver, they have a medical appointment, because that caregiver is there all day. When they get back, the caregiver could provide the services, or if somebody, is having a particularly bad day, especially with supportive housing buildings, the on-site staff could kind of help direct the caregiver to who to see first and things like that. So a pilot has been up and running in King County, but we're looking to expand to other areas in the state, because we really do see that this is a way for housing entities that have had challenges connecting with long-term care to be able to better connect and ensure that individuals living in their housing are able to get the services that they need and historically have had a difficult time connecting with. And then I just wanted to throw in some information on our residential settings, which I have not been talking about because this is about independent housing, but we do have a growing number of individuals in our long-term service and support system with behavioral health challenges. So we have been building up an array of additional supports and services that folks are eligible for who live in residential settings. If somebody's out in the community in their own home, they would be connected to outpatient behavioral health or a program for assertive community treatment PACT, an outpatient, behavioral health system, right, through the managed care organization. In the residential settings, we've built up this array of these behavioral health services that are provided in the residential setting, or there are some specific settings like enhanced service facilities that are residential, and they're more for people with behavioral health needs with lower ADL needs. So we do also have set-asides. So this is work that John has been doing over the past few years. Having rental assistance is great. It does not equate to having actual housing. Individuals we serve can have high barriers to being able to get their application approved to move into a unit. So we've been trying to figure out ways to get tangible housing. So set-asides are, we can go and basically sign a 5-year contract that can be renewed 2 more times for 15 years. We can go, have a set-aside contract where essentially we are saying, you know what, we think we could take 8 units in that building. We'll put our rental assistance in for 8 units in that building, and we'll make referrals and keep those units filled. And then we also are doing global leasing, in which we, another piece of this puzzle in terms of how do we promote true integration in the community when there are individuals who were just not able to get them through the application process. They're always going to be denied. They might have extensive criminal history, arson, they might have a sex offense status. So to promote real options for individuals, we had talked with housing providers, and we're like, hey, why don't people like doing master leasing here, which we're now calling global leasing? And what kept coming up was the risk of the high costs by taking on that lease and then subleasing it to an individual. So what we decided to do is, okay, we have long-term services and supports. We have our contracted housing providers. We have rental assistance. What we don't have is a pot of money to mitigate that risk of a provider taking on a lease and then subleasing it to one of our clients who have our subsidy, who have our services, who have our contracted providers. So we put forward an RFP and had 2 successful bidders in Spokane and Snohomish. So we're piloting a global leasing effort now, where we're able to provide that risk mitigation fund and be able to have these units available for our clients to hopefully be able to discharge straight into their own home in the community in housing of their choice. It's tenant-based, and so even with the set-aside, if the individual wants to move, we can just fill that unit with another voucher. So it's kind of like a hybrid. And then here are our resources. Moving on. Thank you.
All right. So what's really exciting about this, thank you, Whitney Joy. I call her WJH. So what's really exciting about this, you guys have heard a lot about the services. You've heard a lot about how we could leverage Medicaid funds for a lot of these things. And that's really where the Apple Health and Homes initiative is born from. It is system change because it's really trying to leverage these resources that how many people learned today about resources that you didn't know anything about? So what's really exciting is that what the Apple Health and Homes initiative is trying to do is say, hey, these guys got a lot of resources and services. I think the homeless housing, affordable housing world has been doing all of these things for many years in a scarcity of resources. It's time we leverage these resources, but they're very different worlds. And we need to learn how to blend these worlds together. How do you become a Medicaid provider? How do you get access to long-term care and supports? And so those are the things that these 3 state agencies are working very collaboratively together. If we can do it, how do we then bring that message out into the community? And so we're here to support you all with those efforts of bringing these two worlds together. So the Apple Health and Homes Initiative is just that. It's really this paradigm shift. Instead of let's build housing, see who comes, instead it's actually, here's these services, let's wrap housing around all these services. And so that's really what we're trying to do. So my office within the Department of Commerce, within the Housing Division, is all about launching this initiative, but it's also about really expanding permanent supportive housing, increasing the quality of permanent supportive housing, and sustaining permanent supportive housing, because you can't just build it and not expect there's also, and those services are fantastic, but we also need to make sure that your lights are paid for, your maintenance, and any gap that you might have with permanent supportive housing, with operations, maintenance, and services. So we have quite an array of resources within our Office of Apple Health and Homes. And so first and foremost, it is about permanent supportive housing. And there is a state definition of permanent supportive housing. It's RCW 3670A.030. I'm not going to read it. So permanent supportive housing is out there. Apple Health and Homes is a targeted PSH activity. So you can still do permanent supportive housing without Apple Health and Homes. Apple Health and Homes is just a very targeted event where we're trying to integrate with these other systems and leverage Medicaid funds. And of course, permanent supportive housing can come in lots of different forms and fashions. Whitney Joy talked a little bit about sponsor-based leasing or master leasing or global leasing, what we prefer to call it now. So that is another strategy. There's tenant-based, single site, scattered site, and there's project-based. I assume you guys a lot of you are all developers. You're probably more, interested in the capital projects that go along with these different models. And it's really about bringing these three legs of the stool together. So it's about the rent assistance, it's about the operations and maintenance, and the services and the capital. And so what we're really trying to do is try and leverage. Now the challenging part is that the timing. What comes first, the chicken or the egg? Is it the rent assistance that we have in place first? Is it the capital? Is it the services? All of the timing of all of these different legs is very challenging. Plus, we're also really thinking about what's long-term, what's bridge. So what's in red is really considered long-term vouchers. You'll notice that there's a Apple Health and Homes tenant-based rent assistance and project-based rent assistance that's coming soon. That will also be a long-term rent assistance support for people enrolled in Apple Health and Homes. My program also manages the Community Behavioral Health Rent Assistance Program. How many people have heard of this rent assistance subsidy? 1, 2. It's another long-term rent assistance subsidy. We partner with the Healthcare Authority on this long-term rent assistance subsidy. My unit, can't really see it very down there, also manages the HUD 811. So this is also a project-based rent assistance voucher attached to units. We just got our third HUD grant, so we're going to be expanding the HUD 811 voucher program. So you heard about foundational community supports, the eligibility. So that is the foundation. It's really about wrapping housing supports around individuals enrolled in FCS. However, the Apple Health and Homes is just a little bit narrower. You'll notice that Kimberly talked about the 5 risk factors. For Apple Health and Homes, it's actually only the 3 risk factors, 3 of those 5. Everything else is pretty much the same. I'm trying to go really fast. We also have we're going to be launching a tenant-based rent assistance program for individuals enrolled in foundational community supports that meet that eligibility. So we're going to do drawings, and the first priority are people that are chronically homeless, and then also people that have frequent or lengthy stays in inpatient or institutional settings. So these will be tenant-based rent assistance. We're working very closely. A big part of the system change has been data sharing. Everything in the healthcare system and the long-term care system is HIPAA covered. It's health insurance. it's health information. And so commerce, we haven't done a lot of that. And so we've had to enter into some data sharing agreements, and that's taken some time. But we are going to be hoping to launch this tenant-based rent assistance. And these are not bridge subsidies. These are intended to be long-term rent assistance subsidies. So we'll be launching that here in the next couple of weeks to, now of course we don't have a ton of rent assistance funds, and we also will be launching a project-based rent assistance program alongside of the, for the Apple Health and Homes. The biggest kahuna that we have in Apple Health and Homes is the capital funds. So we work very closely with our multifamily housing unit to launch Apple Health and Homes capital funds. We've already issued about $80 million in capital funds to these 14 projects. And the Housing Trust Fund, so we're kind of under the umbrella of the Housing Trust Fund. Those applications just closed. We had $40 million this state fiscal year to issue out in capital funds for individuals that are enrolled in foundational community supports. So we're meeting very closely with those capital projects because this is system change. It's different. Instead of people coming through the regular homeless housing system, how do we work with these providers that are serving people that are in foundational community supports? How do they get their referrals? Do we go through coordinated entry? We have to use a coordinating entity, which is WellPoint. How do we do this? What is Medicaid? How do you provide those services? Do you guys provide the services as housing owner operators, or do you partner with FCS service providers, or both? So all of those questions and issues have been coming up, and we've been meeting with those partners to figure it all out. And this is sort of the plan that we developed, so that when an Apple Health and Homes unit becomes available, we will send that information out through the FCS service provider network, and they will screen people, send referrals to the Apple Health and Homes owner operator. And then the housing owner operator will make their determination, and they will coordinate with WellPoint, our coordinating entity, to make sure that that person is eligible for Apple Health and Homes. So this was a process map that we developed, and we're trying to do this within 30 to 60 days because we know that you may have tax credit properties, and there's really a timeline to get those units leased up. So this is actually a process that we did jointly between all of the state agencies and those capital providers. So we're also working on some tools to help us manage all of this. So we're going to have a software platform called Funds Unit Exchange and Unit Rental Tracking System. That's going to be our hub for tracking the vouchers as well as those units. One of the things that we realized when we were launching Apple Health and Homes is that the homeless housing system may not be familiar, just like the hands that you guys raised or didn't raise. How many people know about foundational community supports? So we realized that we may need to help organizations become FCS service providers. And so we actually launched some capacity grants. We gave money out to help. We actually, this last year, gave 85 grants to help organizations add FCS to their book of business, expand the quality of your FCS program. Maybe it's technology to get, how do you bill Medicaid? So maybe it's some technology to help you with that billing. Maybe it's strengthening your permanent supportive housing. Maybe it's dipping your toes into becoming a licensed community behavioral health agency and really accessing Medicaid in a much broader sense, providing a comprehensive set of services. So we also are partnering with enterprise community partners. I saw Jess Blanch here earlier. We know that to access those funds is a highly competitive, especially the capital funds, very highly competitive. And so we worked with enterprise community partners to provide technical assistance and pre-development grants. So this is some of the work that Enterprise Community Partners has been doing to provide that technical assistance and those pre-development funds. We also We like to take our show on the road. We like to talk about the Apple Health and Homes Initiative. We're all available to come and meet and present and have conversations in communities about not just what is permanent supportive housing, but how does the community wrap supports around permanent supportive housing. And so making sure that the behavioral health system and the long-term care system and the housing owner operators are all working collaboratively together. And so we do a lot of technical assistance and supports. And so I think that you guys are all here because you probably are very familiar with the capital resources. So I'm going to skip that slide, but I did want to talk a little bit about operations, maintenance, and services. So once you build that housing, it's really important to sustain that housing. And so one of the programs that we manage in our office is called the PSH OMS program, Permanent Supportive Housing Operations, Maintenance, and Services. So if you build that building, 100 units, and your costs are $1,000 a month per unit, this is easy math for me. So I recognize that it's not real. So your costs for operations, maintenance, and services, maybe FCS is fabulous, long-term supports are fabulous, but maybe you need some other additional services, coverage to supplement those services that you're providing. We can actually come in and provide that supplement. So that the OMS program is our supplement. We actually do have a funding announcement out right now. It's due October 14th is when you can turn in applications. So it's not only the PSH OMS, but we also, if you have projects that were built with Housing Trust Fund, we also have the O&M program. So it doesn't cover the services, and you don't have to be permanent supportive housing, but you just have to be serving people that are 30% AMI. So that's the OMS program. We want to make sure that if we build it, we also want to make sure that we're able to sustain it. And then we have these other programs that I mentioned as well. One of the things that we as state agencies have been doing is also working with the federal partners through a HUD HHS Accelerator program. And so we're learning about what other states are doing. We're learning about HUD policy, Medicaid policy. So HUD and Medicaid at the federal level are really working together. And so we're really trying to, again, leverage that national technical assistance through this program. And there's been some resources. And so we also actually have a support team. If folks want to learn more about the accelerator, you can also contact us about that. So I just want to go back to the questions and make sure that we're addressing all of the questions. So hopefully we talked a little bit about what permanent supportive housing is. We shared information about resources to make sure that it's affordable for the individuals, affordable that you guys as housing owner operators also have sustainability with resources. We're really trying to think holistically about the individual and holistically about the housing. We've covered a lot of rent assistance programs. And where will we be in 5 to 10 years? Medicaid's not going to go away anytime soon, and our housing crisis isn't going to go away anytime soon. So the more we can leverage Medicaid, these services with the Healthcare Authority and long-term supports through ALTSA, the more we're going to actually be able to really sustain all of our programs in 5 to 10 years. Apple Health and Homes isn't going to go away anytime soon. And if you qualify for foundational community supports as an individual and you have a family, that you're eligible for these family services too. So it would cover the family. All right, any last burning questions? Oh, there's.
So there's a couple that were logged into our WUVA. For AHA capital funded projects, are the rental and operating assistance programs able to be committed to the project instead of just the individual, which I think.
Yeah, so with OMS, it actually is the project. So the OMS program is attached to the building, not the individual. But we've shared, hopefully, resources that are tenant-based as well as project-based resources, both in their programs as well as in the Apple Health and Homes Initiative.
Do we have somebody? I think we've got two.
Thank you for this. I'm wondering if you can just speak about, so the housing world going into the medical world, what are we doing for caregivers and long-term care supports to better understand the needs of people who are living with the most complex challenges related to substance use and mental health?
So I certainly think that, housing first is, I truly believe in housing first, but we also need to make sure, and permanent supportive housing is really intended to wrap supports and services around that individual. What we really need to do is, how do communities wrap supports around PSH? And how do we make sure that there's relationships between the homeless housing, that PSH provider, service provider, and the behavioral health system and the long-term care system? And so one of the things that we're really interested in doing is having conversations in communities, is what we're calling the PSH Learning Collaborative. We've piloted it in Walla Walla County, but it's really bringing together the homeless housing system, the behavioral health system, the long-term care system, to really think about what are interventions that can support an individual. How can we train staff to know that maybe that person, just like Whitney Joy was talking about, being more proactive and getting access to services and resources before it becomes a crisis. But then if it does become a crisis, how do you access those crisis services? So whether it's Ricky's Law or maybe accessing short-term crisis stabilization, but then having a policy, because what we don't want to do is we don't want to see people go into behavioral health system and get stuck in those institutions and not be able to go back to housing. So how do we stop the recidivism of going in and out of homelessness? So if the crisis stabilization program knows that that person has a home to go back to, how do we facilitate those relationships to get access to those services? And so it's really about relationships and conversations in communities to wrap supports around PSH.
Well, I think that brings us to the conclusion, and I'm sure that folks have more questions and want to take advantage of speaking with our speakers a little bit more. We've got a 15-minute break between now and I think the next session, so it should give you enough time to mingle with each other, maybe grab folks for a couple more questions. But how about a round of applause for our speakers today? Thank you.